Good morning, everyone. Good morning. Today I wanted to share something on PUD or peptic ulcer disease. What is PUD, and commonly known as ulcers? Um, PUD or peptic ulcer disease is when you have a sore or let's say a wound on the stomach lining. And you can easily know whether you have that sore or the ulcer. And some of the symptoms are like you have stomach pain, or sometimes we call the epigastric pain, and that pain sometimes radiates to the back, and you can feel this mostly when on your stomach is empty, there's nothing in the stomach, especially at night. That's when you feel that pain, or if you have not taken anything all day, or sometimes if you take foods that are acidic, you feel that one immediately. Even fruits, okay, oranges, sometimes bananas, because they are acidic in nature, you feel that pain. So the peptic ulcer disease, or the ulcers, they can be in the stomach or part of your small intestine, we call the duodenum. So sometimes we call them gastric ulcers, which is the stomach ulcer, or duodenal ulcer, which is the ulcer in the small part of your intestine. Now, there are so many causes of the peptic ulcer disease, or PUD, but the major one is an infection, a bacterial infection called the Helicobacter pylori, or the H. pylori infection. And this bacteria you can get it from the fecal oral contamination, that's contaminated food or water, and once it gets into your stomach, and it compromises the lining of your stomach, which is very protected. Okay, it has a mucous membrane that protects it, but it compromises that one and causes an ulcer. So this you can only find out if you do a H. pylori test, okay, an antigen test. You take your stool and do the test to find out if you have H. pylori. Now, one thing you need to note is that H. pylori, when it has infected that sole, it has to be eradicated for you to say that your ulcers have healed. That's why some people have ulcers for years. They are complaining of ulcers. Ulcer is something that can be treated, but if you have not eradicated that bacteria, then you not heal the ulcers. Even if you use these other drugs like esomeprazole or omeprazole, those PPIs, or sometimes you use antacids, they don't help at all unless you eradicate the bacteria. Now, the good news is that we have a triple therapy combination for treatment of PUD that is induced by the H. pylori infection. Okay, so the triple therapy is a kit that has 2 antibiotics. That's a combination of 2 antibiotics and also a PPI, which is a proton pump inhibitor. Proton pump inhibitors, these are drugs that suppress the production of acid. So that combination is a treatment that takes like 2 weeks. Okay, it's a kit that you take for 2 weeks. And most antibiotics you have, it's either penicillin, mostly it's a penicillin like amoxicillin, and a combination with a macrolide like clarithromycin, and a PPI, which is omeprazole, lansoprazole. That's a gold standard combination therapy. Okay, and this is a first-line treatment for H. pylori infection. Then, after the 2 weeks of treatment, you need to you don't need to go for retesting, because if you test after 2 weeks, definitely the H. pylori will be positive. But that does not mean that you need to take another kit, okay? Because in any case, these kits are very expensive, okay? 2,000 and above, up to 3,000 shillings. For the 2 weeks, actually up to 6,000. So it's very, very expensive. But the 2 weeks is effective to eradicate the bacteria, because the antibiotic there are on very high strength. Amoxicillin, you are taking like 1 gram in the morning of amoxicillin, 1 gram in the evening. That's 2 grams of amoxicillin. Okay. Clarithromycin, for instance, you're taking 500 in the morning, 500 in the evening, which is a very high dose of the antibiotic. And the reason for this is to ensure that you eradicate that bacteria, which is very, very difficult to eradicate. Okay. And again, that kit has a PPI to ensure that within this period of treatment, you suppress the production of the acid. Okay. Then after that, you need to be put on a PPI, that's a proton pump inhibitor, to suppress the production of the acid for a period of time to ensure that there is healing. Okay. But again, note that you also need the acid for digestion. So a mild PPI for maintenance therapy like esomeprazole is recommended. You use that one at least for 6 months. Then after that, that's when you can do a retest for H. pylori infection. Now, something you need to note is that if you don't eradicate the bacteria, there are other complications that are likely to happen. Like you are likely to have some other problems like gastritis. Gastritis is when you have an inflammation of the stomach lining, and usually you experience like the pains, the epigastric pain, a lot of stomach pain. You can also have adenocarcinoma. That's the complication of not treating H. pylori for a long time. You can have stomach cancer. Okay. So the treatment of the H. pylori is very, very important to eradicate that bacteria and ensure there is complete healing of ulcers. Apart from that, you need to have lifestyle adjustments. The foods that you eat, you reduce the intake of acidic foods. You make sure you take food regularly, because the way our system functions, when it's time for food, the system will also produce the acid for digestion, because you understand even from your biology that in the stomach, for enzymes to work, the stomach has to be acidic in nature. So if just imagine if there's no food in the stomach, what happens? Then it compromises your stomach lining, that acid. Okay, that's why you need to take regular meals at regular intervals to avoid such. Now, some of the causes of PUD, I've mentioned H. pylori as one of them, but the use of some painkillers we call NSAIDs. NSAIDs like diclofenac, ibuprofen, such NSAIDs, they're very good painkillers for osteoarthritis, pain, or rheumatoid arthritis. But the overuse of these painkillers can also induce peptic ulcers. But apart from that, there are things like alcohol, cigarette, smoking. All those things can also cause this peptic ulcer disease. So my recommendation is that find out if you have ulcers, find out if you have H. pylori infection, and work towards treating that infection to ensure that there is complete healing of the ulcers. Thank you.